Every day, millions of pounds of iceberg lettuce flow through a highly optimized network of distribution centers and commercial kitchens. In these tightly controlled, sterile environments, food safety is a baseline assumption. That assumption shattered when hospitals across 5 states suddenly reported a severe spike in gastrointestinal illness. Patients were suddenly presenting with debilitating symptoms. They suffered from severe abdominal cramping, explosive watery diarrhea, and rapid weight loss that dragged on for weeks. When a pathogen breaches a fast food supply chain, the scale of the operation works against it. A highly efficient network designed to feed thousands of people instantly becomes a rapid distribution system for disease. This diagram illustrates the culprit, Cyclospora cayetanensis. Unlike E. coli, it is a single-celled protozoan parasite. Once leaving a host, it possesses a unique trait. It requires a 1 to 2 week delay in the environment, called sporulation, before becoming infectious. That delay creates a massive obstacle for public health officials. By the time patients feel sick and seek medical care, the food that infected them has long since been consumed, digested, or thrown away. Standard recall protocols rely on immediate detection. Because this parasite operates on a delayed fuse, the CDC and the FDA are forced into a blind race to retrace a timeline that has already vanished. To find the source, the FDA deploys a traceback investigation. Investigators interview patients, compile their detailed meal histories, and cross-reference the data to find the single common denominator among the victims. The data converged on a specific node, iceberg lettuce served at Taco Bell restaurants, which was processed and distributed by a major corporate supplier, Taylor Farms. The fallout for these brands was immediate. Taylor Farms triggered rapid product recalls, and Taco Bell executed emergency protocols to sever its established supply lines across the affected regions. With the corporate distributor identified, investigators tracked the compromised lettuce backward. They followed the shipping manifests down through the logistical network, tracing the semi-trucks through international border crossings and deep into Mexico. The financial scale and reputational shield of a major fast food brand offer no protection here. A highly visible domestic corporation remains completely vulnerable to upstream errors located thousands of miles away. The traceback finally ended at a specific agricultural farm in Mexico. Here, harvesting iceberg lettuce relies heavily on manual labor and direct physical contact. Investigators determined the exact vectors of contamination. The crops were exposed to human feces and irrigated with untreated agricultural water drawn from open canals right next to the fields. When that contaminated water hits the crop, the parasite's thick-walled spores, called oocysts, physically cling to the rigid, textured surface of the lettuce leaf. Once attached, those thick-walled oocysts are highly resilient. Standard chemical disinfection methods, like the routine chlorine washes used in modern packing houses, simply fail to kill them. If contamination occurs at the root through the irrigation water, the risk is essentially locked in. Downstream processors can scrub the surface, but they cannot reach a parasite that was integrated into the crop before it was ever harvested. Even in the middle of a domestic winter, American grocery store shelves look like this, overflowing with fresh greens and berries. We've grown accustomed to a level of year-round abundance that we rarely pause to question. This consumer demand for a constant 365-day supply forces corporations to look south. During the domestic off-season, supply chains become entirely dependent on a massive influx of imported goods to keep those shelves full. This global reliance introduces significant variables. It means sourcing food from regions that may operate with different sanitary programs or use municipal wastewater systems that lack rigorous treatment standards. The globalization of our food supply ensures that geography is no longer a barrier to infection. A water sanitation issue on a farm in one hemisphere can materialize as a national health crisis in another. In response to these systemic failures, the federal government stepped in. The FDA finalized the Pre-Harvest Agricultural Water Rule under the Food Safety Modernization Act. This flowchart breaks down the rule's new core requirements. Farms are now mandated to conduct rigorous environmental hazard analyses and implement strict agricultural water testing protocols before harvest. This applies globally. Through the Foreign Supplier Verification Program, any imported produce is now held to the exact same safety standards as domestic crops. Protecting a multi-billion-dollar global supply chain ultimately requires a total change in strategy. It means shifting away from reactive damage control in the kitchen and toward proactive policing of the very first drop of water on the farm.